Welcome to natural phage therapy. Large number of people across the world today are suffering from chronic bacterial infections. These bacteria have often become resistant to antibiotics and the person has virtually no escape from the diseases. A possibility of curing such infections is phage therapy. The distinction between phage therapy and antibiotics is that while antibiotics tries to kill the bacteria, and as they become resistant to the medicines, need higher doses of antibiotics, phage therapy makes a fundamental distinction. It works by the phages entering the body of the bacteria, taking it over and self-multiplying. In this manner, phage therapy does not suffer from the problem of antibiotic resistance. We are experimenting with treatment of bacterial infections with the water of Ganga river. The National Environment Engineering Research Institute Nagpur has found that water of the upper Ganga river has 200 types of isolates of phages. They have specifically mentioned that phages that can kill the following bacteria are present in the water. This is not an exhaustive list but only an indicative list. So water of the Ganga works like a wide spectrum phage. Just as we have wide spectrum antibiotics that kill a number of phages, similarly water of Ganga has wide spectrum phages which can kill a number of phages. A number of our friends have taken Ganga water, and those who had problem with their metabolism or energy level, 61% have found relief. Those who had neurological problems, 56% have found relief. Those who had digestive problems, 55% have found relief. Those who had skin problems, 54% have found relief. Those who had urological problems, 50% have found relief. Those who had arthritis and joint problems, 45% have found relief. Those who had diabetes, 40% have found relief. Those who had cardiological and heart diseases, 36% have found relief. And those who had respiratory diseases, 33% have found relief. These are tentative results. We are now finding that by prolonging the treatment to 3 months, many of these diseases have better cures. Be that as it may, as of now, about 50% of the people who have taken Ganga water have found relief from their diseases. The Ganga water can be taken by 3 methods. First is to take about 20 ml of water in your hand and to put it in your mouth, swish it in your mouth, and then breathe inside while keeping the water in the mouth, and lastly to drink it. The second and the best method is to take it by a nebulizer, which vaporizes the water and the phages in it, and they are taken directly into the lung, and from the lung they spread through the entire body, including the digestive organ. So in case we have problem with the digestive system, even then taking through the nebulizer route is more effective. The third, especially for skin diseases, is to apply it topically on the affected part as well as generally. Even if we apply Ganga water on a normal skin, part of it is absorbed into the body and it is quite effective. Question is asked whether taking of Ganga water is safe, especially because of the pollution therein. We take water from the upper stretches of Ganga above a place called Rudraprayag, where it is virtually pollution free. Further, we store the water with the sediments. The phages in the water absorb onto the sediments and they can lie dormant for years. Once they sense the presence of bacteria in the water around them, they become active, they enter the bacteria and finish it off. we have taken water from Rudraprayag in May 2020 and we had it tested at the People's Science Institute in Dehradun in February 2021. We found that the water had no coliforms, which means that the phages in the sediments have cleared all the coliform in the water. Therefore, taking this water in our assessment is safe. We understand that the established method for phage therapy, especially in the East European countries, is to take the phage from a natural source such as a river or a lake, then identify a particular phage which will kill a particular bacteria, isolate that phage and then amplify or multiply it and then give it to the patient. We feel, and our experience is, that this tortuous process is really not necessary. We simply give the cocktail of 200 phages to the patient and we leave it to the phages in the water to select which bacteria are present in the body and to kill them. And in this manner, we have found that the same water is effective against a number of diseases as we have mentioned above. Therefore, we feel that it is not necessary either to freeze it for transport or to centrifuge it. We can simply take the water and store it with sediment for say a month, allow the phages in the sediments to clean up the overlaying water and then use that water for treatment purposes, and it is not necessary to either freeze it or to centrifuge it before using. We have found, however, that if sunlight reaches the stored water, algae tend to develop in it. Therefore, we have developed a procedure that we filter the water to remove the fungus and algae but not the phages. Then we take the sediment, wash it with the filtered water to remove any possibility of algae and fungus, and then reinsert the sediments into the same filtered water and then supply it to the prospective volunteers. In this manner, we remove the algae and fungus but not the phages, and we have found that this procedure is quite effective. Our assessment is that if one takes Ganga water orally, then it requires about 1 liter per month for a patient, and for a course of 3 months one requires 3 liters. Whereas if one takes by nebulizer, one requires about half a liter for 1 month and about 2 liters for a 3-month course. We are happy to supply this water for you for your experimental use. We make clear that we are not medical scientists. I am a social scientist. I am an economist by training. I have a PhD in economics from University of Florida, but I have been involved in conservation of river Ganga and have therefore got into this curative project. However, we have a number of doctors who are supporting us in this project. We can provide you the details if you so desire. On the legal aspect, let me inform you that our project is entirely legal. In India, there is no bar on experimental use of any medicine. The only requirement is that we should not advertise it as a cure for particular disease. We make clear that we are only inviting you to join in this experiment, and we are not claiming that a particular disease will be cured, but we do find that Ganga water is quite effective against a number of diseases as we have described above, and we welcome you to join this experiment and help this world to get rid of bacterial diseases and especially the bacterial ailments that have become resistant to antibiotics. Please do not forget to like and share this post and to subscribe to our channel, and for more information please write to us at this email ID or contact us by WhatsApp at this number. Thank you and welcome.